Hello. As many are celebrating with their moms, we thought it would be a good time to look at the issue of maternal health, specifically Black maternal health. A local state lawmaker is leading an effort to pass laws to help Black women have healthy birthing outcomes. Plus, Morris Chestnut is the star of the new CBS hit show Watson. He joins us along with another co-star to talk about the Pittsburgh-based drama and the season finale. So pull up a chair and meet us at the corner. Intersection starts right now. Hello, I'm Lisa Smith, the Director of Community Impact at KDKA Plus and the host of Intersections. The issue of Black maternal health has been getting more and more attention for a number of reasons. We know that pregnancy-related complications cause Black women to die at twice the rate of white women. Those deaths occur either during pregnancy or up to a year after. Here in Pennsylvania, there are a number of state lawmakers and birthing professionals who are trying to reduce those deaths. So joining us in this segment to share what they are doing are State Representative Latasha D. Mays from right here in Allegheny County. Also, we have Carmen Alexander. She is a community health worker with the Midwife Center. Thank you both so much for being with us today.
Thank you for having us.
Absolutely. This is obviously a really important topic. For you, Representative Mays, why was this something that you really wanted to take up and take up in the legislature?
Well, one, I'm proud to represent the people of the 24th Legislative District. That includes the Hill District through East Liberty to Homewood and East Hills. I've been a longtime advocate for reproductive justice as well as women's health. And so I led a nonprofit for 18 years, New Voices for Reproductive Justice. And we came to the work of Black maternal health through addressing the shackling of pregnant women in Allegheny County Jail in 2009 and 2010. But at that time, I didn't recognize that as Black maternal health work until we had the National Black Mamas Matter Alliance. They created Black Maternal Health Week, which is celebrated April 11th through the 17th. And towards the latter part of my time leading New Voices, we would lead the efforts for Black Maternal Health Week in Pittsburgh, Philadelphia, and Cleveland. Mm-hmm. And so that is how that's how I entered into the work. And so when I arrived in the legislature in 2023, my good colleague, Rep. Gina H. Curry of Delaware County, she said we should have Black Maternal Health Week at the Capitol. Mm-hmm. And the rest is history, because shortly thereafter, we launched the Pennsylvania Black Maternal Health Caucus in October of 2023. What we know is that Black moms in the Commonwealth are dying at nearly 2 times the rate of Black moms, 2 times the rate of white moms in the Commonwealth. Mm-hmm. And that 93.5% of all maternal deaths among all moms and birthing people are preventable. So the question we have sought to answer is, why aren't we preventing those deaths? And so we know we start with saving Black moms and birthing people, we save all moms and birthing people.
Yeah. Well, you had, and we're looking at some of the video now, there was a summit, yes, legislative summit here in Pittsburgh about a couple of weeks ago, back in April, during that week. Why was it important to bring those legislators here to Pittsburgh to talk about this topic?
That's a really great question. Again, I want to mention I have 2 co-chairs, Rep. Gina H. Curry of Delaware County outside of Philadelphia, as well as Rep. Morgan Cephas of Philadelphia County. And we have been leading the work and doing really great work across the Commonwealth, in the Capitol and in the Philadelphia, southeastern Pennsylvania area, but we really hadn't done anything in western Pennsylvania. And so we weren't in session during the week of Black Maternal Health Week this year. So we decided, well, let's not talk to an empty building. Let's take this show on the road. And so no better place to take the work of the Pennsylvania Black Maternal Health Caucus than to the Steel City. And so they were very supportive of making sure that we bring the energy, the momentum, and our vision to reverse the disturbing trends of Black maternal mortality in our Commonwealth and bring that very conversation and call to action. It was Pennsylvania's call to action that we wanted to center in our summit. And we said it must happen in Pittsburgh, and we really work to have people come from not just Pittsburgh and Allegheny County. We have folks from Erie, we have folks from Meadville, we had folks from all over, from Lawrence County as well as Cambria County, come to Pittsburgh for our summit because we wanted to put the issue of Black maternal health on the map in Western Pennsylvania, and we did just that, with not only Pennsylvania secretaries attending, our Lieutenant Governor Austin Davis and his wife, the Second Lady Blair Holmes Davis, participated, our Mayor of the City of Pittsburgh, Ed Gainey, our County Executive, Sarah Morado, and all of my reps who came from across the Commonwealth. It was really powerful, especially those here in Allegheny County, but to have folks from Harrisburg and Philadelphia area and so many other places travel to Pittsburgh for this summit. Again, Pennsylvania's call to action for Black maternal health. It was groundbreaking, it was transformative, and it did what we wanted it to do, which was to center the work on not only legislative action, but how do we change a culture that allows Black moms and birthing people to die in our Commonwealth?
Yeah, I know a part of that also involved conversations with doulas and midwives.
Yes.
And so I want to bring Carmen into the conversation because you're with the Midwife Center. Yes. How does the center operate, and why do women decide to come there to give birth versus maybe giving birth in a hospital?
Thank you for that question. Yes, the Midwife Center is the only independent birthing center in Southwest Central Pennsylvania. So our clients come to us for a variety of reasons. We will only take low-risk pregnancies. But we service not just Allegheny County, we service surrounding counties. And people come there, I'm a patient there, I had my children there, and they come there for the same reasons I did back in the 90s. It's because of a different experience.
Yeah.
The Midwife Center looks at the whole person, and it's not just a medical procedure. Not that hospitals don't have great things to do, but we have really qualified, certified nurse midwives. We have nurses. We have a wonderful staff, and also we have my role, which is a community health worker, and I'm also a community engagement coordinator. And the purpose of that is to look at the whole person and figure out that, from an equitable perspective, how can we provide them with the resources that they need in order to make the best choices for themselves. We do have a reproductive justice framework that we're looking at it right now, and so many people want that experience. A person can come to the Midwife Center, have their child, and then go home the same day. Yeah. If there is a reason for them to transfer to the hospital, there's many reasons for that we have a qualified staff to do that. We work directly with UPMC and with West Penn Hospital to make sure that our clients have that care.
Yeah. So speaking of resources, one of the resources I know Representative Mays, you talked about, is the Momney bus, and we're seeing some of those images now. What is that? We have about a minute left. Tell us a little bit about what that is and how that gets that message out, that information out.
Sure. So the Pennsylvania Momney bus is a package of legislation. It is modeled after the federal Momney bus and the Congressional Black Maternal Health Caucus. And so it is 9 bills that me and my colleagues, my co-chairs, we introduced in the House. We announced that on the second day of the summit on April 15th at the City County building, and they address research-based interventions such as blood pressure monitors for preeclampsia. We are looking at the material needs that moms and babies have through the Maternal and Newborn Supply Kit program. We're addressing breastfeeding, midwifery practice, as well as looking at maternal health deserts. And my rep here in Allegheny County, Ariane Abney, is also, as a part of that package, introduced the PA Dads Matter Act. So we are really focused on a comprehensive approach to Black maternal health in the Commonwealth.
Okay, well, we're going to continue this conversation. We're going to take a quick break, but we want you to stay with us for more of this conversation about maternal health intersections. We'll be right back. So today we're talking about Black maternal health and the efforts in Harrisburg to ensure better outcomes for moms giving birth. Staying with us for this segment is State Representative Latasha D. Mays, and we also now have joining us University of Pittsburgh Associate Professor Dara Mendez. She is also the co-director of Embrace Center of Excellence. Thank you again for being with us today.
Thank you for having us.
So, Representative Mays, tell us though about how laws do play a factor in the outcome or improving the outcomes of women.
Well, I believe as a longtime policy advocate and now as a state legislator, that our policy impacts culture and our culture impacts policy. So we want to see certain changes in our communities, in the way that our institutions carry out their work, especially around healthcare delivery, maternal health, and Black maternal health in particular. We have to set the bar high. We have to set the bar even in a place where moms and birthing folks have equal and equitable opportunities to have a positive birth outcome. And right now we're not seeing that. Black moms and birthing people are dying more or living sicker before, during, and after their pregnancies. And so creating laws, it tells what we value in our society and in our culture. And so we in the Pennsylvania Black Maternal Health Caucus want not only the people of this state to know, we want the world to know that Black mamas matter. And so that is really what has driven the work of our caucus over the past year and a half.
Yeah. Professor Mendez, tell us a little bit about the Embrace Project, what it is and how it works to help, moms who are trying to have healthy outcomes.
Yeah, so Embrace is a maternal health research center of excellence, and Embrace stands for equity in maternal and birthing, as well as reproductive health outcomes, informed by community engagement, right? And so really the thought around the development of Embrace was to uplift reproductive health and justice, specifically for communities here in Allegheny County through research, training, practice, and policy. And the center is co-directed by a number of leading partners in reproductive health, rheumatology, and maternal and fetal medicine. But what's really critical around our center is community engagement. Research really cannot move forward without community engagement, without centering the lived experiences of people who are experiencing disproportionate outcomes. And some of our key partners include Healthy Start, New Voices for Reproductive Justice, the Midwife Center, the Allegheny County Health Department. And really the thought behind the work is that in addition to understanding that inequities exist for Black birthing people, as it relates to maternal death, we know that there's also disparities in maternal morbidity, meaning there are long-term health consequences that come out of systems and environments that are not supportive of health and well-being. Some of the key tenets of the work that we're doing are ensuring that there's elevation and understanding of that work, but also using research and data to inform the existing policies. How do we evaluate the policies that exist? How do we also use research to evaluate new interventions and new solutions? And then how do we develop data-driven processes informed by community? Without that information, how do we make decisions, right? So it's really important and critical that we do that. One of our core research projects is focused on interconceptional care in the 4th trimester. And what that means is that we're really centering what is happening also after delivery, right? More than 60% of maternal deaths are in the postpartum period, so that's after delivery. We also know that Black women are more than 3 times as likely to not have a postpartum visit. And so that means that there are elements that may be missed, right? So after delivery, there is a likelihood that that person would have access to care for their infant, right? They're going to a pediatric visit, but what about that birthing person? And so the current model that we're working with now is called Implicit, and it's really within a family medicine practice setting where you're caring for the infant and the birthing person, and integrating reproductive justice in that work.
So is this work that they're doing here in Pittsburgh, is that work that you can use legislatively as evidence of the need for some changes, the need for the state to get behind awareness and other things that could help bring these numbers down?
Absolutely. One, we are really blessed to have the quality, this research center of excellence here in the city of Pittsburgh, in our community, led by Dr. Mendez and her colleagues. I absolutely use the data that they provide, and we talk regularly about what are the trends, the distilled down data, because most of our data is statewide data. So how do we look at this region and the needs may be different for Black mamas and birthing people in Western Pennsylvania and in the greater Pittsburgh region than it might be in other parts of the Commonwealth. And so we are they're greatly intersected, and the root of the work of us all is in reproductive justice, and this idea that you have the human right to control your body, have a healthy birth, have a joyful birth, and to live to see your children grow up. And so we are shining a bright light, a legislative light, a data and research-based light, as well as a community practitioner light on the issue of Black maternal health here in this region.
Yeah, we have like 10 seconds left. What do you hope is the final result of all of this work?
The final result of the Pennsylvania Black Maternal Health Caucus, as well as those of us here today, is to make sure that Black moms and birthing people do not die before, during, or after childbirth. They matter, and that we have everything in our power to prevent these maternal deaths.
All right. Well, thank you all so much for being with us today and sharing this really important information. And hopefully we'll have a chance to just connect, just to see how things are going with this work. Thanks
Thank you
again.
so much.
Thank you.
Thank you for having us.
Absolutely. Well, coming up, stars from the CBS drama Watson join us to talk about the Pittsburgh backdrop and season finale. Intersections. We'll be right back. Well, if you're a fan of Watson, the CBS original series that airs Sunday nights on KDKA, we're all on the edge of our seats to find out what will happen in this medical mystery drama. Pittsburgh is the backdrop for the show, so I had a chance to talk to the show star Morris Chestnut, who plays Dr. Watson, and Randall Park, who plays Moriarty, about their roles, the Pittsburgh setting, and what we can expect for the finale. Morris, tell me a little bit about, why you wanted to even tackle Dr. Watson.
First and foremost, it was an opportunity to be a part of the iconic mythology of Sherlock Holmes. Of course, it's been, it's iconic around the world, and to have an opportunity, as an actor, you're always playing these fictitious characters, and this is a fictitious character, but it's iconic. So that was that's what first drew me to it. And then I met with Craig Sweeney, our showrunner, and he told me, he informed me of the storylines and how the characters were gonna evolve and the arcs. And after I met with him, it was a no-brainer. I said I had to be a part of it.
Yeah. Randall, Moriarty. I was listening to the previous person, and they were saying, how, I saw those images where you would have a nice, pleasant face, and then you go sinister, like on a dime. Tell me about, what it was about this role for you that made you say yes.
Well, same as Morris. I mean, just to be a part of this mythology of Sherlock Holmes is really an honor, and the great lineage of actors who have played Moriarty. The opportunity to play such an iconic character, but also to be able to play this version of Moriarty has been so fun, because he is by design just kind of an everyman, a nice guy, on the surface, but balancing that out with the real true diabolical nature of this villain has been just so fun to play, and then also getting to play opposite Morris Chestnut and the entire cast. Everyone is just so amazing, so kind, and I just really had a great time.
Yeah, speaking of the cast, I have to say that the brothers, I really could not tell that they were twins. One, that it was the same actor too. So talk a little bit more about the quality of this show, the quality of the acting, and what viewers are really getting out of this.
Yeah, so that's what Craig Sweeney wanted to do is very, very ambitious. When you do a network television show, your time is very limited. So when you have one actor portraying twins on the show, it requires so many more resources and so much more time, because of course that actor who's in the same scene, he's in the scene as one character, and he has to go change and come back and do the other character. So it's so much more time consuming. So it's very ambitious for Craig to do that. It's turned out great. And Peter Mark Kendall, who was portraying that character, or those characters, is doing a tremendous job. He works really hard, as does our entire cast, and it's showing. I'm glad you noticed, because he does a tremendous job.
Yeah, yeah. So the season finale is coming up. What should we expect? I'm sure it's going to be a cliffhanger. So what are we in for?
You're in for part one of the cliffhanger. We have to make a decision which one of the twin brothers we're going to save. So you will see that conclusion in the finale. I'm not sure if it's going to be a conclusion, but you'll see Watson and Moriarty go head to head. Not sure how that's going to turn out, but most things don't turn out well when you're up against a villain like Moriarty. So we'll see what happens.
Yeah. The other thing, obviously, is, it's set in Pittsburgh. We're in Pittsburgh. There's a lot of scenery, lots of areas where, we all recognize the skyline and things like that. I know you were here last summer. Are you coming back for this next season, doing some more shots, tell us what can we expect here in Pittsburgh in terms of the production of the show?
First of all, everything, you guys were so gracious while we were there. So thank you to everyone who we came across while we were there. And yes, I do believe that we are coming back for the second season. We had such a great time, and our showrunner Craig Sweeney is from Pittsburgh.
Right.
And so it's very fond memories of him being, growing up there. So yeah, I think we'll definitely be back.
Yeah. And Randall, I mean, did you get to come the last time?
I did. I had that scene on the incline, which I didn't even know about the incline. I had worked in Pittsburgh before, but I didn't know about. So getting to learn about this historic thing that's very specific to Pittsburgh was really fun, and I do just love the city, and the people of the city are amazing. So yeah, I can't wait to be back.
And you can watch the season finale of Watson on KDKA TV Sunday night and streaming on Paramount Plus. I'll have my last word when we come back. Congratulations. That's the word for CMU history professor, author, and now Pulitzer Prize winner Dr. Etta Fields Black. You may remember Dr. Fields Black was a guest on Intersections last year to talk about her amazing book, Combie, Harriet Tubman, the Combie River Raid, and Black Freedom During the Civil War. Her book about the stories of enslaved people freed in a historic raid led by Harriet Tubman won the 2025 Pulitzer Prize for History. Congratulations, Dr. Etta Fields Black. And thanks for watching. We'll see you next time on Intersections.